Hey everyone, I'm Chris Riley and welcome to the Daily Dose of Radiation. Today we're going to be talking about what makes an adequate chest x-ray film. So I use the mnemonic RIPE, which is R for rotation, I for inspiration, P for projection, and E for exposure. So Skelly's going to demonstrate all of these today. So rotation, we're looking at the spinous processes on the back in relation to the clavicular heads. If the patient is rotated to the left, then that spinous process is going to be closer to that right clavicular head. And if the patient is rotated to the right, that spinous process is going to be closer to the clavicular head on the left. After that, we have inspiration, which means the patient needs to take a good inspiratory effort, and an adequate inspiratory effort should show the diaphragm around ribs 8 through 10. If it's past there, that's hyperinflation. If it's before that 8th rib, then we're worried about hypoinflation. Maybe the patient isn't taking a deep enough breath. Next up is projection. Is it an AP, which is anterior to posterior, or is it a PA, a posterior to anterior, or is it a lateral, which remember, patients' hands need to be above their head to get an adequate lateral. And lastly, E for exposure. And what we mean by exposure is how much radiation you are sending from your X-ray source to the backboard. And we know a film has adequate exposure when you can see the thoracic spine disc spaces clearly on your PA or AP chest x-ray. You have an overexposed film when the patient is getting too much radiation. So the film is going to be black. You're not going to really be able to discern anything. When you have an underexposed film, you're not getting enough radiation through the patient and it's not penetrating all the way through the patient. So you're going to see a lot more radio-opaque material. Everything's kind of just going to be white, and it's going to be harder to discern pathology from normal stuff. And that's a quick run-through of how to tell if a chest x-ray is adequate.